Hello, my name is Austin Carman. I am a student at Nebraska Methodist College, or NMC, and this is my final capstone presentation. I researched the public issue of the lack of CPR education in the community and that impact that it has on public health. According to the Journal of Emergency Medical Services, increasing bystander CPR is vital, as it can significantly improve survival rates for out-of-hospital cardiac arrest, OHCA, victims. Although some work is being done on this public issue, rates remain low in high-risk areas. I started my research specifically in Omaha, Nebraska, as it is a prominent issue. However, I found that the lack of CPR education presented a significant national public health issue, as cardiac arrest leads to more deaths than various other major causes. In an article about CPR outcomes inside and outside the hospital, cardiac arrest claims around 436,000 lives annually in the U.S. alone. According to the CDC, in 2022, heart disease was the leading cause of death in Nebraska, highlighting the urgency for immediate intervention during cardiac arrests. Research shows that prompt CPR can double or even triple survival chances. Yet, only around 40% of individuals who are experiencing a OHCA receive bystander CPR before emergency services arrive. Bystander intervention is crucial, as survival rates decrease by 7 to 10% for each minute without CPR. According to CPR Select Facts and Statistics, communities with high rates of bystander CPR report better survival outcomes, but there is considerable variability in CPR activation rates across regions. Once CPR is initiated, survival rates do not vary significantly by gender or race, as the effectiveness of CPR is the only key determinant. CPR timing, defibrillators availability, and the CPR quality significantly influence survival. Individuals trained in CPR are more likely to act quickly and effectively, emphasizing the need for broader CPR education to improve response rates to save lives. As a future healthcare professional, I must be prepared for adverse events such as cardiac arrests. However, I also feel that it is my role to educate others on the importance of being knowledgeable in life-saving skills such as CPR. I have a personal connection to this issue. This connection is through that of being a CPR instructor at NMC. I strongly believe in the importance of CPR training and certification for everyone. I have participated in many community events where we teach the community for free how to perform CPR. I am also one of the primary instructors for Friends and Family CPR, a class offered through American Heart Association at NMC. This course is offered to all community members and highlights the importance of being CPR trained. Now on to the educated citizen portion of this presentation. I had the opportunity to attend a community service event for prostate screenings. This was a great learning experience which helped me demonstrate being an effective communicator. The event was held at a car show, and all male attendees were provided free prostate cancer blood tests. I was stationed at the front of the booth, signing in individuals to get their blood drawn, providing information to anyone who had questions, and handing out brochures on more details and potential websites they should visit. At this event, I learned the importance of guidance towards information and new knowledge, which is intertwined with being an effective communicator. I learned from this event what a rural community thinks of healthcare and their understanding of prostate screenings. A topic that I discussed several times at the community event was how they screen for prostate cancer. There was a lot of misinformation regarding what a prostate screening would look like, making a lot of the clients uncertain about participating. As part of the pre-assignment, the group I worked with decided to create brochures about prostate cancer and the importance of screening. These brochures became an excellent education route for the clients at the event. Overall, this experience helped me get closer to becoming an effective communicator because there was a lot of education and explanation of prostate cancer and the importance of prostate screening. There was a lot of fear about the screening and the results, and a lot of misinformation associated with prostate screening. A major insight I learned was how to alleviate this problem with the help of the correct information. Healthcare professionals play an essential role in educating the community, and this experience has shown me that. I can use this learning when approaching how to increase the amount of CPR education. Many individuals hesitate to perform CPR on strangers due to various fears and misconceptions, such as worries about responsibility, doing it incorrectly, potential legal repercussions, and health concerns. Suppose that individuals knew the importance of knowing CPR similar to how we taught people the importance of screening the prostate. there would be an increase in CPR knowledge in the community. In my second effective communicator experience, I demonstrated my effectiveness by representing NMC at several conferences. One specific conference in which I demonstrated being an effective communicator was at the American Association for Men in Nursing, or AAMN conference. At the AAMN conference, I received the Student of the Year award for my work with my chapter in Nebraska, and I was honored to participate in the Emerging Leaders panel. On this panel, I took part in answering questions about how to increase membership for school chapters and how to get more students involved in leadership. During this experience, I used my presentation and public speaking skills to effectively communicate answers to questions and share my leadership story. I learned that it is essential to be an effective communicator to ensure that what is being said comes across and is understood by the audience. This experience has taught me the importance of being an effective communicator inside and outside the nursing field. I've always understood the importance of being an effective communicator in nursing. However, I've learned that being an effective communicator is vital in all aspects of life. No matter the conversation that I am having, my point must be clearly portrayed. This experience, what I have learned, will serve me in the future because it has made me a better public speaker. Speaking at a conference on a panel has made me better prepared to discuss with patients and participate in other professional organizations. Insights for being an effective communicator can potentially help address my public issue, since I can use this experience to speak of the lack of CPR education in the community. Being a reflective individual, an experience where I demonstrated and learned something important about being a reflective individual, was during my Healthcare Spanish Community Engagement course. During this event, I worked with Families in Action, a social service organization in Omaha, Nebraska, and I would discuss topics of healthcare with a community partner. During a specific interaction with my partner, we discussed the topic of misunderstandings and racism. My partner said that she had been treated differently in the hospital because of her language barriers. Although this was one of many conversations I had during this course, these interactions were significant for reflecting on my bias and stereotypes that I may subconsciously create. I learned so much that I wouldn't have learned about myself and the community without this experience. I'm excited to apply this knowledge in my future role as a healthcare professional by being more understanding of all my patients. A healthcare professional's job is to treat everyone equally and show equity. Working with Families in Action was great because I found while reflecting on this experience that similar organizations are needed for every community because of their impact that they have on these communities' health. This experience, what I have learned, will serve me well in the future. Creating partnerships with places like NMC is a great way to promote and advocate. A potential way to address my public issues by working with groups like Families in Action and other organizations. Through partnerships, we can spread more awareness of CPR education and approach many different communities. Another significant experience where I demonstrated learning towards the goal of being a reflective individual was at my clinical pullout for lead screening. For clinical, we experienced public health by assessing and performing lead screening for elementary school students. The childhood lead screening programs increase education and awareness of the risk of lead exposure. If a child had high levels of lead poisoning, we were able to give education to the families on prevention and treatment. In this experience, my clinical group went to locations near the Superfund site in Omaha, which is the lead cause of Omaha's lead toxicity. Working with the Douglas County Health Department, we screened the public for health problems and addressed any issues by providing resources and/or services. This experience taught me how to change my communication depending on the situation. The pediatric population comes with its own sets of challenges with effectively communicating. When educating patients, it's also important to remember that not everyone has my medical education. Therefore, I learned to use words that are easy to understand and make the teaching not intimidating for individuals. I plan to improve my abilities as a future nurse by reflecting on this clinical experience to change how I treat patients in various ways. With this clinical experience being my first time working with kids as the main population, I learned many different approaches to how to work with children. We would distract the kids and make them more comfortable with the tools before continuing with the screening. In the future, I plan to implement teaching and promotion of resources that are available in my treatment of patients. While at the clinical experience, there was a discussion with the public health department about how many individuals in the community fear the health department and have unrealistic views of what the health department does. With this in mind, I plan on improving upon my teaching methods, performing assessments on needs, and formulating plans based upon said needs. These learnings can be applied to address my public issue, as healthcare professionals can play a key part in being trusted individuals. Also, the skill of learning how to communicate differently can potentially address my public issue. Many times in my career as a CPR instructor, I've taught younger individuals. Eliminating the fear of cardiac arrest events may potentially alleviate a lot of the stress of learning CPR. Being a change agent. One significant experience where I demonstrated learning towards the educated citizen goal of being a change agent was when I went to Orlando, Florida for the National Student Nursing Association NSNA conference. I had this opportunity through being on the Methodist Student Nurses Association MSNA leadership team. At this conference, I volunteered to be a Nebraska delegate and the representative for MSNA. As a delegate for Nebraska during the House of Delegates meeting, I used my voice to advocate for patients, nursing education, healthcare, and the nursing profession. Attending the resolutions hearing allowed me to share my opinions with fellow nursing students, multiple healthcare organizations, Congress, and the public. Through this experience, I have learned the importance of nurses and nursing students being on boards and the significance of voting on policies that will influence the future of care. By voting on which resolutions NSNA should focus on, NSNA can properly spend resources promoting education and awareness of certain subjects expressed in these meetings. As future nurses, it is our job to advocate for those who do not have the power to do so. I have been a change agent in nursing through the debates and votes I participated in. I accomplished the goals of NSNA by passing new resolutions that will impact the future of the nursing profession and the education of nursing students. I plan to improve my abilities as a change agent by continuing to serve on boards and expressing my thoughts and ideas with the discussion on important healthcare topics. Potentially, this can address my public issue, as I can bring this public issue to the spotlight of major organizations and get more attention on this topic as a public issue. With resources gained from being part of a professional organization, I can have a more considerable impact, as I will have the support of others in addressing this issue. My second experience as a change agent was as president of the NMC student government. There were several circumstances in student government where I demonstrated what it means to be a change agent. My most significant part was being part of the planning of many community events and participating in activities that benefited my community. I worked with the student government group to find what needs were wanted in the community and at NMC, and worked towards giving aid in those areas. One of the events we planned, of which I was a major part in, was called the Blankathon. At this event, we created Tide blankets that we donated locally. The Giving Tree is another example of an event we put on while I was president. This event had a holiday tree in the main lobby of NMC with toys and winter clothing for people to donate and take from around the holiday season. These community service events positively benefited the communities and influenced change in these areas. From this experience, I learned the importance of being a change agent. Before being appointed president, I was still deciding whether I would be ready to lead student government. Thankfully for my mentorship from my previous year as vice president, I learned much of my skills and what a leader truly stands for. A leader must have respect and dignity when leading a team and working with others, even when they have alternative points of view. I learned that it is vital for a leader to be a change agent in their area rather than being stagnant or taking the position without direction. During my time as president, I could have quickly decided to just hold the title and not do much with the experience. Still, while studying for tests and pushing myself in my nursing courses, I made time to be a change agent and make a change at NMC and in the community. What I have learned will serve me in the future because of the leadership skills I gained from this position. I believe that from this experience I am more prepared to lead others and make changes in the community. This experience has granted me leadership skills that I would not have gained otherwise, and these skills will serve me in the future when I decide to become more involved with organizations. These skills and experience have granted me insights that can potentially be used to address my public issue. Having the behavior of a change agent and motivating others to join a cause is a powerful ability. With my public issue, my initiative and determination gained by being a change agent will allow me to pursue this public issue and make change. In conclusion, while efforts are underway to address the public issue of CPR education, it remains a significant concern. Continued efforts are needed to enhance CPR training in the community, which could substantially increase the rate of bystander CPR, which could double or triple the survival chances for OHCA victims. CPR is a vital skill everyone should learn and understand. With my knowledge of being an educated citizen, I will be able to apply the skills I have gained to address this public issue. With my knowledge as an effective communicator, I know how to approach medical topics in the community in various ways and appropriately engage in conversations. As a reflective individual, I know how to use my assessments to implement public health programs and policies with community and health department input and work with impactful partners. Finally, as a change agent, I've learned leadership skills that can motivate others to join my cause, and I've learned to work with others who may grant me more resources. As an educated citizen, I will promote and establish change to increase the education of CPR in the communities. Thank you for taking the time to watch my capstone presentation, and here are my references.